All right, so imagine this front door of this beautiful home is the door to the doctor's operatory. And your goal is to help the patient get from here, right? This is when they walk into your hygiene operatory. This is your time with them. And this is the doctor's operatory. So our goal is to get them from here all the way into saying yes, that they're ready for treatment. So we've got to figure out what are the different steps to get to there. And part of this permission is doctors, you letting your team know how far down that diagnostic path you would like for them to take your patients. So some of you might say, I would like for my hygienist to take the patients right here, which is establishing the problem. And then I'm going to come down the steps and I'm going to come right here and I'm going to establish the solution. I'm going to share with them what the solution is. Totally fine. Some of you, we had a doctor in a class recently, and I asked that question is, how far do you want your hygienist to take patients down this diagnostic path? And he said, I want the patients to be ringing the doorbell. So before he comes in, he wants patients to be ringing the doorbell, which means really he comes in and all he has to do is just nod his head and say, yep, I completely agree with what you said, Rachel. Mary, that's what I would do. I would move forward with that right away, okay? So you've got to establish, doctors, where you want what you would like your clinical team to do in that regard, and then you've got to give them permission to do that. And it has to be explicit, because sometimes it's implied and you think maybe they know, but they don't really know. So you really have to explicitly say, I'm giving you permission, I believe in you, and I'm confident, and we're going to continue to work on your skills in this area, but I would like for you to really take this patient all the way down that diagnostic path as far as possible.